Hey, Mark. Yeah, welcome to the Plastic Surgery Consults.
Excellent. Yeah, thanks. This is our episode 4, looking at breast recovery. So breast surgery recovery. So yeah, why don't you give us a little rundown in terms of what a typical recovery would be from, a breast augmentation or breast reduction or breast lift?
What you see online is really most often marketing based in some respect. I mean, there's a lot of great information online, but I think a lot of the information to feed to patients is try to get patients into your office, try to get patients to come do surgery, all the benefits and great things about surgery. Now, a really key part of a surgical procedure is the recovery. And it's the time spent away from your surgeon, away from you and I, Mark, is the time spent in recovery. So surgery is 2.5 hours. Recovery is, well, how many weeks and months does that take? So really important to discuss that with patients so they have a very reasonable expectation. Also, because when they're planning their surgery, they have all kinds of other things going on in their lives. They have, family members to take care of. They have jobs. They have to tell their workplace an idea of how long it'll be, how long they'll be like fully out, how long maybe they can come back on a diminished capacity. So I think really this is really front and center for most people. And it's important, I think, to talk to every patient about this because their jobs are different, right? And really, we don't really know what their job entails, and we can't give them an exact idea until we really discuss with them what they do and then, what may be possible based on their job description and their life.
I know this has been kind of, even the idea of lost productivity and lost time is a really big one in terms of outcomes. I know Dr. Toma at McMaster University did a lot of great work trying to really look at even like disease states and say, okay, well, what does this mean in terms of how valuable is this on a global level in terms of looking at like anything that could be wrong with someone, or say in this case of very large breasts, like what does that cost in terms of productivity? Well, with surgery itself, you do lose some productivity for a period of time, and people really want to know how much that is. People that are coming in for elective surgery that are paying for it also have to, some people they're considering in terms of how much they're going to make and how much they're going to lose. But I think time is a very valuable commodity. So I think it's a very important one on most people's minds.
Yeah, to the point where I think some people come in to chat and all of a sudden they're thinking, well, let's see if we can even combine surgeries, because knowing that each surgery you do, there's a certain amount of recovery involved. So, are there ways to do, if you have multiple things on your agenda for long term, maybe some of these surgeries can be combined. Therefore, one recovery time period, there may not be a difference in terms of cost per procedure, but the idea that you're just having one period of convalescence where you're not able to work, or you're, because there is a cost of a procedure, but you touched on a really important point there, Mark, is that there's a cost to not working. There's a cost to recovery.
Yeah. So why don't you give us an idea of what, because I know our counseling is slightly different actually. Why don't you give me just a general idea of a patient coming in for like a breast lift or breast reduction? What are you generally telling them in terms of expectations for recovery in most cases?
So there's a few aspects of recovery. The first is just getting over the procedure itself in terms of the medications you're given for a general anesthetic. So really there's that first 24-hour window where you may feel quite good. You get home from surgery, day of surgery, you're feeling strong, but you can't jump in a car and drive because there's a lot of medications in your system that takes really 24 hours to clear. So there's that first 24-hour window, which I guess would be kind of period number 1 for your recovery, where you just really need to lay low.
Yeah, and just to pitch in there for a second, but also maybe in terms of women of the age demographic for breast surgery, a pretty high incidence of nausea. So I think depending on anesthesiology techniques and different things they can do, there are things that can minimize that. But that first 24 hours, you can run into that problem.
Nausea from the anesthetic, perhaps, particularly when you're using like a gas anesthetic. IV anesthetic tends to be quite a bit less. But also once you start introducing things like narcotic pain medicine, so morphine, hydromorphone, oxycodone, right? Those have the potential to cause nausea in certain people. So it could be both the surgical medications, but it could also be medications taken to help with that initial early recovery when maybe things like pain might be high. That can also cause nausea. So yeah, really important point, Mark, is that is a really critical piece of the or considerations taken in a surgery, and that's something to be discussed with the anesthesiologist and surgeon before. If you know that you've gone through this before and you've had a lot of nausea, There's always more that can be done, but it is a good idea. There are a bunch of little things, little tricks that can be done to really minimize that.
Yeah, I know that's great. Yeah, so yeah, and then what do you tell them in terms of? I guess I break it down to the kind of next 2 weeks. Do you do that as well? Do you kind of after that first 24 to 48 hours, then you're looking at your kind of first 2 weeks of recovery?
Yeah. I mean, well, why don't you share what you say, and then I'll plug in, because I think for me it's kind of the 24 hours, and then that first month, I think you're right. There's kind of things to consider as you go along that month path.
Yeah. So for me, I always mention that first 2 weeks being a time when really most people, I'd say, don't really feel up for too much, really decreased energy level. And also they're seeing some studies about just generalized decrease in mood. So anhedonia, like basically this kind of blasé feeling or even depressed mood can be expected in those first 2 weeks. And then generally speaking, there is some appreciable increase in at least energy level at the 2 week mark. So I think generally people are feeling significantly better at 2 weeks. I guess the way you mentioned it, really after those first 24 to 48 hours as well.
I think that's just a really important point what you mentioned there about that first 2 weeks, about having that maybe some slightly depressed mood. And when you think about a surgery, it is a trauma. It is a very controlled trauma. It is done in a safe way. But the body itself sees it as trauma, and there is inflammation throughout the body. And then one of the influences of inflammation on the brain is that, slightly depressed state. So yeah, and that again varies on the person. Some people come into surgery as someone with maybe some issues with depression. So that you can just consider that as part of your recovery process, right? That these challenges you might have may be slightly more challenging.
And really from that 2 to 6 week mark though, that's where we see a tremendous amount of variability, at least I find in my patients. So I say from 2 to 6 weeks, you may feel great. It may take you 6 weeks to kind of get back. So that variability is difficult to predict. But I'm interested to hear what you say about that first month.
Yeah. So basically, there's a couple waypoints. I think at about the 3 week mark, generally, if there is any kind of manual massage that may be required for recovery, for example, if you have any kind of liposuction, at around the 3 week mark, people can start doing some massage. I think before that point, it's just a bit too sore, too much manipulation of the tissue. But around the 3 week mark, I feel pretty comfortable that whatever I've done for shape, usually it's sutures that I use to shape tissue, whether it's the breasts or other part of the body, there's enough collagen, there's enough scar to hold things enough where I'm comfortable allowing things like massage. But yeah, so I think around the 2 week, I think, some of it depends on the individual patient in terms of kind of what drives them. So for some people, particularly people, let's say, that have their own business, they really need to get back to it. And, or some people just find it less stressful to be at work than to be at home. So, young kids, for example, which is very common in our patient population at home, right? So they can have very busy households. So it's a bit hard to tell people, oh, you're going to be off for 2 months or you're going to be off for 2 weeks. I mean, I think at about the 2 week mark, I think people who are very driven, I think, can very realistically return to some form of work, not manual work, but cognitive work, I think, assuming they're not on any, again, the other key piece is very few of our breast patients wind up on any kind of narcotic at the 2 week mark. But if they are still taking anything like hydromorphone or OxyContin, oxycodone, they really can't really be fully, I guess, aware enough to be doing high cognitive task work.
Yeah, I think some other kind of points that people are interested in are like, when can I drive after surgery? And that's obviously a bit of a question, but I think ultimately, if you're not taking any narcotic medications, so anything that can alter your ability to kind of perceive or judge, and if you're kind of feeling well, and then if you're able to kind of go, I think one good test, this isn't perfect in all cases, but so I don't want somebody coming after us for saying this, but I think if you go into an empty parking lot and can kind of really comfortably do a 3-point turn, like fully turning your body and really having no pain whatsoever in any distracting way, then you wouldn't be considered a distracted driver in most cases. So that, again, that could be a variable amount of time. That could be 2 weeks, it could be 6 weeks, it could be a few days.
There's just a lot of variability in it. And a lot of it, I think it is important that the patient considers themselves. There's no textbook answer. Just be very aware. I mean, you don't want to hurt yourself as you're recovering, obviously, but you don't want to hurt anyone else. And getting in a car is one of those things that could be dangerous to others if you're not in a good enough state. Yeah. So I think what you're saying is interesting. That, the 2 to 6 week, I think that's maybe something I should change slightly in my delivery to my patients. I think I usually tell people really at about a month, I'm pretty comfortable with them really doing anything physically. So that first month, I generally want people to not be doing, especially after breast surgery, not do too much like chest working out, upper body workout things, even things like running. That's very kind of moves the upper body a lot. I prefer people not to do a lot of that in the first month. Month 2, I kind of open the door. You can do anything you want. Just listen to your body. If your body says it's good, it's okay. Because again, this related again to just how we heal. The collagen that's required to kind of give that steady new shape, I think at that point is very reliable. I do say if you're doing like something very vigorous, week 4 or week 5, that you do wear some kind of support, for example, a bra. And I think that's very helpful. But I think you are right. I mean, once you get to that 6-week mark, for most people, they are feeling quite good. And I think, by about the 8-week mark, I think that's another kind of important waypoint. I think the average person is feeling pretty much like they did before surgery in terms of their energy level. What do you think about that, Mark? Even in terms of swelling, I just tell people, do not buy new bras until 8 weeks. You're just going to be too swollen after surgery, and they may not fit you, right? If you're buying a bra at 4 weeks.
I do very slightly in what I tell my patients. I generally tell them it's really that 6 weeks mark is kind of the point where I'm comfortable with them kind of sweating. So I don't really want them doing any kind of vigorous sweating usually before 6 weeks, or swimming. But at 6 weeks, I pretty much let them do anything as long as there's no kind of issues with delayed healing. But I do tell them that, like, even at 6 weeks, and I think this kind of echoes what you're saying, but the 8-week mark, you're still going to swell a fair amount. You're still going to be pretty sore with whatever you're doing, potentially, especially if you're going and trying to work out again. So introduce activities gradually still at that time. You may not get kind of peak performance if you're doing CrossFit or any of those kind of things. And you want to just kind of be a little bit, ease into it.
We've gone through this prolonged period of time of limiting your activity to suddenly go back to what exactly you're doing before. That's kind of this whole weekend warrior thing. You'll do the same thing you tried 6 weeks earlier, and the next 2 days are going to be sore because your body, your muscles aren't used to it, right? So I think that's absolutely right.
Maybe you could touch on a little bit more about the, so I think we have a general idea there. We can go back we do have some good papers just to quickly go over about those things, but we'll go over more. But I was going to just maybe touch on just briefly that point on massage. So I think there is a decent amount of variability among practices in terms of the use of lymphatic massage or just massage in general on scar tissue. I think there are definitely some practices that actually introduce massage therapy kind of immediately, like post-op day 1, especially some of these kind of places where you travel to, like our friend Dr. McKevin Yu in Florida. I know he has them doing massage therapy pretty much the next day. And I think that is another approach that is reasonable. I think with generally in our patient population here, they may have some benefits that may cover some of this massage. And I think true lymphatic deep massage is pretty tough to tolerate before a couple of weeks. I mean, if you do tolerate it, great. But if you're really going to get your money's worth, I think from a lymphatic massage, I think in general, it's going to take you a few weeks to do that. But yeah, I think maybe early massage might be good. And I'm open to the literature and the studies or the experience of other people. And that would be something I'd be interested in potentially instituting earlier.
It's something for us to keep our eyes on for sure, that people are introducing this sooner. I guess the idea that, the sooner you get the lymphatics moving, the quicker the swelling goes away. The other thing is, it's not uncommon for people to come back 6 months after surgery and they're doing different movements, right? They're moving their arms in different ways or they're sleeping and they move a certain way during their sleep and they feel a twinge, right? I think that is normal. So that does happen. And I think a lot of that, again, it's related to the recovery after surgery. So scar tissue forms. If you don't do a certain movement, that scar tissue will not break down, right? You have to push your way through scar tissue in various ways. And it takes 6 months to really get that range of motion or whatever it takes to make that twinge happen. So you can have that twinge, you can have some swelling. It's okay. It just means that you now have regained that motion. You've lost some of that scar tissue. Because there are people who come back months later and say, this happened to me the other day. Like, I was very scared. I just want to come see you to discuss it. And it's usually a pretty quick discussion. to kind of ease their mind on it.
I think the previous couple of podcasts we did on scarring and the sensory sensation recovery, I think both kind of dovetail nicely into the conversation today. But absolutely, I think that whole process, again, that scar maturation process, that collagen deposition and reorganization really does happen for a couple of years after surgery. So
right. So yeah. So I know you want to talk a bit about some numbers. I guess the other thing I would just say about just maybe some specific surgeries, like any surgery with liposuction, there can be kind of hardened areas where the liposuction cannula, where when fat is sucked out, the remaining fat can have some scarring to it, which does very reliably soften over the course of 8 weeks, but it can sometimes be 3 months or 4 months. It can be a bit longer sometimes. The other point I just wanted to tie was what you mentioned about your 6 weeks about not letting them swim. I totally agree with that. I mean, if there's any opening in the skin at all, swimming is not a good idea. And that's different than showering, right? So showering, the water just flows over your body. There's no negative pressure. If you're underwater, any little opening, water will make its way in because there's that pressure gradient that will push the water under the skin. Then that water may not come out, and that could be dirty and could give it a late infection. So I think, yeah, definitely in terms of swimming, jumping in the lake, definitely not before 6 weeks, and really just verify that there's no kind of openings in the skin at all, no scabs, nothing like that, no sutures before exposing.
Right. So I think of the concept too about waiting for kind of vigorous activity and sweating. I think that's an interesting one, and because I think there's a controlled injury that happens with surgery. This results in inflammation, which results in collagen deposition and all of these things that are important. But that process of inflammation, when you're having a surgery on the breast, there's usually some sort of empty space that can be filled with fluid because there's been incisions and movement of tissues. Your body is going to absorb that fluid at a certain rate, and you're going to produce that fluid at a certain rate. And I don't know entirely if this is entirely driven by studies or data, but it does make sense, intuitive sense, that when we sweat and we're producing a lot of fluid with activity, that same fluid and edema can occur in the body. And I do know for sure that when patients are more active and they have drains in, for example, those drains pick up significantly. And when they rest and relax for a couple of days, those drains diminish very much so. So I think that's another reason why I really tell people that before 6 weeks, you don't know if your body's going to be able to keep up with that fluid accumulation, and it may not. And if it doesn't, particularly in a breast lift or a breast reduction, that's when you may see some fluid egress or some small opening at the more gravity, where the gravity is most at the bottom of the breast, because your body has to get rid of that fluid. And so if it's not getting rid of it by absorption, it's going to push it out the skin basically. And that results in a small wound, which does heal quite quickly in the majority of people. I think in that case, that's a very common call, I think, in terms of postoperative complications that we get.
Patients see that as well. They see when they're active that they get more swollen, right? In the early days, that's why we sometimes do put drains in people, and people who are more likely to develop severe swelling, people with higher BMI, so people in the kind of obese range based on height to weight ratio, usually require a drain because their body cannot absorb the fluid at the rate at which they're producing it. Or very large breast reductions, sometimes we consider a drain. But I think you're right. In people who are very active, maybe they should receive a drain as well, because if they, it is very hard when you tell people to be less active, particularly, I mean, a lot of our patients are, mothers, right, with young families. It's impossible. I mean, they cannot be inactive with, a 3 and 8 year old, right, running around at home. So yeah, there's some things we have to be realistic with, but then again, we know they're that active, so please don't go for a run on top of all you're already doing, right, in your busy lifestyle.
Yeah. I think in that recovery, but occasionally we do get that phone call from the emergency room of a patient that at like the 2-week mark or 10-day mark or whatever it is, has just hit the wall. And I think I think a lot of it is from that basic feeling a little better, picking up that little extra t-shirt off the floor, maybe sweeping the floor, maybe cleaning up the dishes a little more. But all those things can add up. And even if you're feeling a little better, you can really kind of knock yourself out. And I've even seen it where people have ended up in the ER. And literally the reason is they've just done a little too much and their body hits a wall. I don't know. Have you seen that as well in your practice? I've definitely seen it on occasion.
Yeah. And I know I often do warn patients too, particularly in that second month as they're going, like people are back at work and they're at work and they hit that wall, right? When your body is healing after surgery, it is still in this inflammatory state. The first 2 weeks probably the most, obviously, but it continues. You have to kind of listen to the feedback your body gives. The production of collagen is a very demanding, metabolically demanding process for your body. It is very energy intensive. So you go back to the daily grind, you might be fine. And there are plenty of people, I think maybe you'll discuss the numbers now, Mark. I know you have some great studies that have looked at, recovery after breast surgery, breast reduction, mastopexy, and augmentation. And it can be quite quick, but there are lots of caveats. And that's why, having someone to talk to through your recovery is an important part of the recovery process.
So let's look at basic things, return to work and daily activities. This is a study in the breast reduction literature out of the UK. Survey of plastic surgeons, they had a consensus, so basically recommending return to work and driving at about 19 days post-operatively in that experience.
So return to work, just to confirm, this basically 3 weeks.
Yeah, so that was an interesting one. Sedentary work, and driving within 3 weeks. So that's like, office-based, computer-based, work from home kind of stuff.
Right, and there are a lot of people with those kind of, white-collar type jobs. Yeah.
Yeah, and I think there's another study here out of the Journal of Clinical Medicine in 2023, return to work after breast reduction, showing an average return to work of about 4 weeks, plus or minus a week, and prolonged recovery, meaning around 5.5 weeks in about 20% of patients. I think these studies are just useful because these are telling you kind of average experiences. And I think everyone wants to be better than average, but overall, average experiences are useful to know.
It is, it is good to hear that. The other thing, though, I think our patients are actually more in tune than you might think in terms of the average. Because when someone comes in at the 8-week mark and like, listen, I'm still having a hard time, right? It is important for them to understand those numbers that we're discussing are exactly that. They're averages. There are people on both ends of the spectrum, and there are different things that may cause your recovery to take longer, right? Stress at home, busy life. One of the big ones that I find is fibromyalgia, right? So fibromyalgia is a condition. It's a hyperinflammatory condition. I mean, it's a condition where you feel pain longer, right? So that, for people with fibromyalgia, I just tell them, I know you have this. Just know that your recovery is going to be a little more difficult, right? I mean, you're here with fibromyalgia because you feel more pain in your upper back and neck, and that's why you're here for breast reduction. But your recovery may be more intense or just maybe more prolonged. And as long as you're understanding and aware of that, you won't get frustrated at that 5 to 6 week mark when you're not where everyone else is.
And you may be somebody that you probably already have a pain management specialist on board, but you may need one post-operatively, right? So those are all things to think about. Yeah, just a couple of things about that one study that I was just quoting. An interesting finding there was that, they didn't find, they really found that it's, if you have any complication or issue, then that's going to kind of put you in that longer duration group. So any kind of like wound healing issue or small like infection or anything like that, that's going to be the primary driver of those prolonged recoveries. Even more so they found than things like body mass index and smoking status, which is interesting.
I guess that makes sense though. If you need to go back into surgery again for an issue, then that's going to restart the clock in some ways. But even things like infection, again, an infection is a very inflammatory process. This is what we're trying to get over. So when you redouble that with something like infection, well, that's going to slow down the whole process.
And then we're looking at, people want to know about final aesthetic results. There's been a bunch of studies on that. And really you're looking at probably about a year for most, 3 to 12 months in terms of stability of the results. So the result's going to continue to evolve in terms of breast lifts and breast reductions, as well as breast augmentation. So we talk about that initial fluff and dropping phase and all that. But by 12 months, you're pretty stable in terms of that. Return to strenuous activity and exercise. It's basically, we were saying that, I think you're saying 4 to 6. I'm thinking more 6. But most surgeons here advise avoiding heavy lifting and strenuous activity for 4 to 6 weeks post-operatively. And that's from the upper limb longitudinal recovery after simple mastectomy, implant, and breast reconstruction study.
Yeah, it looks like we're on track and consistent with the literature. But there's no one size fits all for this discussion. So really important to talk to whoever you're working with, your surgeon.
I think if you ask a whole group of surgeons, is their recovery time better than someone else's? Well, what would you say? Do you think your recovery time is better than anyone else's? And when people are telling you that you're going to get back to work in a day or two, or what would you say about that? What's your general thought? Do you think it's more patient driven, this return to work, or do you think it's more surgeon driven, or can we really have that kind of impact?
Yeah, I think it's hard to say. I think, at least surgeons here in Canada, I mean, they're very well trained, right? And I think there's a very high standard across the board. So I don't know if there is, and certainly there are small differences in technique, but I just think overall, there's a certain amount of time that your body takes to recover from a significant trauma that is surgery. And there are things I think we'll touch on in another podcast, things like little protocols that can get people kind of out of hospital quicker, get you feeling well quicker, things like ERAS, right? I would question if someone is saying like, listen, you come to me after your breast augmentation, you're going to be, running marathons 2 days later. Well, that's just inconsistent with the biology, right? So what do you think, Mark? I mean, do you think?
I think, sometimes a primary breast augmentation can be a very quick and simple procedure. And so maybe less damage is inflicted than maybe a breast lift or a breast reduction in some cases. But yeah, I think you're right. I think it's more of a marketing kind of thing. Come in for your lunch hour and have your breast augmentation and get back to work kind of thing. I think I would be suspicious of any of that. And I think that's less prevalent in Canada, but certainly I think in other places of the world where there's a little bit more marketing drive, or even in Canada, in markets like Toronto, where there may be more of those kind of things you may see. I think that the ERAS, the enhanced recovery after surgery protocols are great. And I know you and I have been employing these. A lot of surgeons actually have been, because they do work. And I think with this, in terms of studies, we're looking at probably reducing your recovery time and certainly getting you back to certain activities sooner. But I think that's more of a protocol issue, less than a I'm brilliant, I'm the best surgeon thing. But maybe it's just like employing things that are known to scientifically help recovery, like, being well nourished before surgery, doing certain washing protocols, drinking certain amounts of carbohydrates, different things like that can be done, taking pain medications at a certain interval. Those protocols, I think, can certainly help.
Yeah, and I think those ERAS protocols are most effective in the first couple of days after surgery, right? In the first few days. I mean, that can certainly, I think people's early experiences can definitely kind of change their frame of reference and kind of make them feel better about the whole process. And maybe that could ultimately get them to recover overall quicker. But some of these time points, I think, are based again on the body's ability to put collagen together and to reshape things. So there's, but I think really things like ERAS really make the actual process of early recovery after surgery much more just gentle and much kinder to the patient. And why not? Why shouldn't we be doing everything we possibly can to make the experience of surgery better?
But interesting, right? Like, who knew that maybe chewing gum after a tummy tuck might get you have less issues with, constipation, or, there's different things that can be done and have been looked at. We actually wrote a paper on that. That's why I'm mentioning it. One of our med students kind of took that one. But it's interesting. These are things that are definitely, that I think we as surgeons should pay attention to and try to implement in our practices. But I think the label on it has to be less about me and more about, the science and the protocols and the different things that we know can reliably help people in their recovery process. And I think, one thing I get asked a lot about is a kind of alternative medicines, peptides, exosomes. Yeah, I mean, I think these are things that can certainly play a huge role within recovery. Optimal nutrition, being in an inflammatory state. What's the diet that Dr. Orthopedic colleague at McMaster would always...
Right, Dr. Morrow, I mean, basically like eliminating certain high inflammation foods for certain people. Things like, in some people, things like gluten can be highly inflammatory, or dairy can be highly inflammatory in certain patient populations. So these are, again, individual things to consider.
And again, we don't necessarily have all that information here today. I think it might be something we can delve into in the future, though. Maybe get a couple of experts on here that discuss those topics. I know certainly the peptides topic, I think patients are running ahead of me a little bit.
They're teaching us in the consults what's going on. I'm like, oh, really? Gosh.
Do you want to mention pets in post-operative recovery? How do you feel about pets?
Yeah, I have, a pet myself here at home. But yeah, so the biggest issue with pets is the potential for infection for yourself, right? So you're healing, you have open areas, incisions are closed, but not fully closed. And pets tend to have a lot on their fur, especially like, cats or dogs sleeping in the bed. We just tell everyone really before surgery, all your bed sheets, if you have an animal in the bed, they must all be washed and cleaned. And then the pet should not be sleeping in the bed with you after surgery. You can tell, when people do develop these infections, they're generally gram-negative infections. They can sometimes be gram-positive, but gram-negative infections only really occur, in kind of the bowel regions of the body, right? So, and that tends to not be from people. It tends often to be from pets, right? So really, I just find I've seen over the years many late infections in patients with furry animals in their beds. How about you, Mark?
The dog and the cat really should be out of the bedroom before surgery and after. And that's very difficult for people. So I think it's something it's worth mentioning, just because there are people that are very attached. Their pets are very attached to them, and they're very attached to their pets.
And at a time of stress, right, which surgery is a time of stress, you're almost more drawn to your pet to sleep with you and give you that extra layer of comfort. And those gram-negative infections are difficult to treat, especially, in the breast, particularly if you have like an implant or something like that present. It could destroy the whole surgery. So definitely, you're right. That's good thing you touched on that.
Okay, great. Yeah. So I think some of these principles we discussed today are applicable to other areas of the body as well. I think quite a few of them are, but I think we really wanted to focus today in terms of the breast recovery, and I think we covered it. I think we covered a lot of it, at least.
Yeah, and I think again, there's some areas I think we could take a deeper dive in the future here, but yeah, this is a good start, and it was nice for us to kind of touch on some of the literature as well for ourselves, to keep ourselves up to date on all the latest in recovery, and there's a lot more to figure out in plastic surgery and in surgery in general, but there's also a lot out there that can kind of inform ideal care. So, and the perhaps the most important piece is that the patient, whoever's going for the surgery, has an idea of some of these concepts, and then can bring them up with their surgeon. I think often surgeons are already doing these things, but by participating in your own care, you can make sure that you really have an optimal outcome.
Absolutely. Okay. All right. Thanks a lot.
Thank you.